February is a time of year when we put special focus on children's dental health. That's why I'm at Sunrise Dental at the Raleigh office talking with Dr. Dirk Weiss. Dr. Weiss, how soon should a child come see the dentist?
We can start as early as any parent feels comfortable bringing their child. Most of the time we say they're special. Their first real appointment should be about 4.
Okay.
It seems to be 4 is a magic age where kids start to understand that even if they don't want to do something, it's still for their own good. And we are able to make it fun, and it's not just a really scary experience. And that's one of our biggest emphasis in this is keep it fun, keep it light. We don't ever want to traumatize a child and make this something that they don't want to do.
Right, so let's talk about care at home. What are some things that parents need to make sure they help their children with when it comes to taking care of their teeth?
Well, absolutely. You've got to make a child learn to floss their teeth and brush their teeth. If the teeth touch, and you see all these beautiful kids with the beautiful smiles and the teeth all touch, all those teeth have to be flossed, and that's one of the biggest causes of cavities I see in teeth in kids. But also, not make it too overbearing. Make it fun, make it light. Electric toothbrushes are great for that. Kids really enjoy playing with their electric toothbrush and letting them do it for a while. And then mom and dad just kind of follow up, and it really makes it a much more pleasurable experience than any other way I found.
Well, the great thing about children is they're going to get a new set of teeth, right?
Absolutely. They've got a spare on the way. This is almost like training teeth, if you will. We obviously don't want our children to get cavities. We don't want our children to lose their teeth early. But what we definitely need to do is make sure that they learn healthy habits for the rest of their life, and definitely not want to shun the dentist because of bad experiences trying to hold on to baby teeth.
So when we talk about baby teeth, if a child does get a cavity, is it necessary to fill it since it's going to fall out anyway?
It depends on when it happens.
Okay.
If that baby teeth is going to fall out in a few months, absolutely not. It's my recommendation that don't induce any trauma that we don't need to on a child. Let it go. But if the tooth is going to hurt the child before it gets kicked out, absolutely, it's something would need to be done, some sort of intervention. But to lose the tooth in 3, 4, even 6 months, I just don't see the point in that.
So there's no one-size-fits-all policy.
Unfortunately, there's not. I know it'd be nice to have a cozy little box where we could say these are the rules, but every child grows at a different age. Every child grows at a different rate, I'm sorry. And every child needs their own special treatment. And that's unfortunately how it is.
Right. So can you describe what the visit is like for a child who maybe hasn't been, so that some of that anxiety is taken away?
A lot of times the first visit we want a mom and dad to come with them, and we're a little different. We want mom and dad to come back with them sometimes if it makes them feel better. I've also had patients bring their children with them to their appointments, and the child sits on their lap for the duration of the appointment for their cleaning and sees that it's not scary and it's easy. And we have TVs and we do things to make it as fun as possible for them.
Fantastic. Great advice, Dr. Weiss. Thank you very much.
Thank you. My pleasure.
Be sure to check out Sunrise Dental on the web.